All right, good morning again, everyone. We just finished the legal and regulatory subgroup of our marijuana legalization work group, and now moving on to the fiscal and structural subgroup. I have a lot of the same membership as on this group that was on the previous group, but we have some new names and faces as well. So I think let's start with some introductions, because I forgot and skipped that on our last group meeting. But maybe just everyone introduce yourself as we go down the list. So first, Jen Michelle Padini.
Good morning, everyone. I'm Jen Michelle Padini. I'm the Development Director for the National Organization for the Reform of Marijuana Laws, and I serve as the Executive Director of the state affiliate, Virginia NORML.
Great. Thanks, Jen Michelle. Jewel Bernal.
Good morning. This is Jewel Bernal.
Hey, Jewel, I'm sorry to cut you off. I think something is wrong with your audio.
Can you hear me?
Yeah, you're kind of muffled. Is it the same for everyone else?
Okay, I can rejoin using my iPad.
Okay. All right. So we'll come back to Jewel. Kristen Collins from the Tax Department.
Hi there, I'm Kristen Collins. I'm the Policy Director at the Department of Taxation.
Thanks, Kristen. Angus.
Good morning, folks. I'm Nigas Tabebi with Columbia Care. I'm the Director of Public Policy, so I work on cannabis-related policy issues in multiple states as well as federally.
Thanks. Nate? We had Nate. Nate might have had to jump off. Let me see if we... there he is. All right. I think we can probably hear you now, Nate.
All right, thank you. Nate Green, Commonwealth's Attorney for the City of Williamsburg and James City County. Also a member of the Virginia Association of Commonwealth Attorneys.
Great. Thank you. And then David Brown, Dr. Brown.
Hi, I'm David Brown. I'm the Director of the Department of Health Professions, which has sort of representing Caroline Jurin, who is Executive Director of the Board of Pharmacy, which currently regulates the pharmaceutical processor medical marijuana program.
All right, Mike McKenzie.
Hi, I'm economic researcher for the Center for Urban and Regional Analysis at VCU.
Great, thank you. And you'll remember, everyone, we had Fabrizio Fasula with us last time, and he's taking a new role, and Mike is going to be representing the Wilder Center. So thank you, Mike, for joining us. We're really looking forward to working with you. Michael Carter from VSU. Let me see if we lost him. Michael, can you, I think I just unmuted you. All right, we might have to come back to Michael. Colby Ferguson.
Colby Ferguson, I'm a Senior Policy Analyst at the Department of Motor Vehicles. I work primarily with CDL compliance, and I track the marijuana-related legislation for the agency.
Great, thank you. Linda Jackson. We may have lost DFS. Captain Boyd from the State Police. We may have lost Captain Boyd as well. Let's see if I'm going to call on Charles Green from VDAX to see. Charles, have you heard from Jewel? Was she able to get back on her iPad? I don't see her on our list.
I have not, but she should be trying to get back on, and if not, I'm definitely prepared to serve as a proxy as she comes to get back on.
Okay. Oh, I see her. All right, Jewel, I think you should be able to talk to us now.
Hear me?
Yes.
Okay. Hi, this is Jewel Bernal with VDAX, and I'm happy to have Charles Green. I don't know if Charles introduced himself, but I wanted to have Deputy Commissioner Charles Green introduce himself along with me from the Virginia Department of Agriculture.
Thanks, Jewel. And then I would point out also that we have, in addition to Kristen from Department of Taxation, we have Joe Mayer on the call with us too. Joe, would you like to say hello?
Good morning. Can you hear me?
Yes.
Okay. Thank you. I'm just listening in and trying to learn a little bit more about this subject.
Great. Thanks, Joe. And then the last person I see on our list that hasn't had a chance to speak yet is, well, first of all, we have Secretary Brian Moran joining us. He joined us for the last part of the last meeting as well.
Brad, once again, as schedule allows, I'm going to try to join as many of these meetings as possible and learn from our panelists as well as special guests. So appreciate being able to join you all.
Great. Thank you, Secretary Moran. Really appreciate you giving your time to us this morning. And then representing Secretary Dan Carey, we have Katie Finley, Assistant Secretary of Health.
Hi, yes, this is Katie Finley representing Secretary Carey, and similarly looking forward to joining as many of these as I can. And thank you so much for having me, and excited to help Brad, and especially Brad, appreciate all your work leading this work group. So thank you so much.
Thanks, Katie. And I'll say thanks to the whole team. We have a really great team working behind the scenes from 4 different secretariats to make these meetings happen. So after those introductions, first thing on our first item of business on our agenda is to select subgroup chair and vice chair, or the last group did 2 co-chairs. So in the same way that we did for that last meeting, you know, these folks are just going to kind of be the points of contact for us as staff as we go throughout this program to make sure that we're staying on top of things and helping us to both gather and get information out there. So I've heard from a couple folks that they're interested in serving in a role for this subcommittee, but would open it up to the floor to see if anyone would like to volunteer.
Morning, Brad. It's Jewel Bernal. I am happy to serve as co-chair of this subgroup.
Thanks, Jewel. And I don't see him on the call, but you did tell me that you had a conversation with Travis Hill about this as well.
Yes, asked if Travis Hill from ABC would be interested in serving as co-chair, and he graciously agreed that he would be willing to do so.
Great. So Travis is on this subgroup, but was not able to join us today. But appreciate his willingness to also serve in that role. Is there anyone else that would like to volunteer? All right. If not, I'm going to ask us to take a vote. We neglected until the later part of the last meeting to actually do this vote, but I think for public record's sake, we need to call the roll and just say ayes and nays on our 2 co-chairs, which would be Dr. Jewel Bernal from VDAX and Travis Hill from ABC. So Jen Michelle Padini.
Yes.
Jewel Bernal. Kristen Collins.
Yes.
Auguste Abebe.
Yes.
Nate Green,
Yes.
David Brown,
Yes.
Mike McKenzie,
Yes.
Michael Carter, Michael, are you, let's see if I can unmute you. All right, Colby Ferguson,
Yes.
Linda Jackson, or did anybody from DFS join? If you're on and you can't speak, just shoot me a quick note and I'll add you. And then anyone, Captain Boyd or anyone from State Police join. I'm still looking and I don't think so. All right, I think that's our list and it's unanimous. Thanks everybody. So at this point, you know, many of you have already been through this drill before in the last meeting where we kind of open it up to a group discussion of potential policy questions. But I think this meeting is going to focus much more, whereas the last meeting was focusing on the laws and regulations for a number of different subject areas in Virginia that would need to change if we legalized adult use marijuana. This group is focusing on the fiscal implications for the state, which is one of the main topics that the General Assembly has asked us to look at. And then also structurally, where in state government would these types of regulations fall? Who would have the responsibility of implementing a marijuana program? And so I think this is going to be much more of a high-level discussion in terms of state policy. But then when we talk about the fiscal impact, we'll need to have some discussion about market size, demand, tax rates, you know, how that revenue could potentially, where that revenue could potentially be needed or be used to implement this program. So we'll have to get down into the weeds on that. But I'm going to put her on the spot a little bit, but Dr. Brunel, after having been through this once before in another subgroup, and as the new co-chair of this, I'm wondering if you might help us facilitate some of this discussion, and I can jump in as needed. And then Heidi Hertz, the Assistant Secretary of Agriculture and Forestry, is sharing her screen to take notes for us like she did in the last meeting. So Jewel, I might just turn it over to you if you're willing to help us do this.
Yes, I sure am. Thank you so much, Brad, and I'm happy to serve as co-chair of this. We have been in some discussions, as have many of you, in terms of looking at the structure of other states. I think that we have enough information that we have gleaned from other states in terms of the structure and how they're set up, that it's going to be a great benefit to us. One thing that came to mind immediately was the importance of establishing a seed to sale tracking system. And it will allow us to do much in terms of identifying the markets, who's going what, where, how to make those decisions in terms of supply and demand, and all of the components that go into the IT background and the policy background with that system. I think there are things that we should consider in terms of the types of positions that we will need in terms of oversight of a program. And as was brought up on the previous call, you know, what agencies are going to be identified to take charge, whether it will be several different agencies or whether or not there will be an umbrella agency established. As you look at the various states, it ranges from different areas from, for example, the alcohol and controlled and beverage licensing to enforcement divisions to departments of agriculture. And sometimes there's been a new umbrella established. Other times they have divided up who is going to do what. I think we need to consider how we're going to do this work across multiple agencies in the various roles. And we will definitely need to consider how many positions, FTEs, will be needed and the potential cost that's going to be associated with that. So I think these are some of the things that we'll need to discuss during this subgroup. I appreciate Charles Green so much for allowing us to have several different conversations with a few states. And I wanted to ask Charles if he would also weigh in on some things that we may want to consider as part of this subgroup here today. So Charles, please feel free to add some additional points that will be important to discuss today.
Sure. Thank you, Commissioner Bernard. Charles Green with the Department of Agriculture. We have had a couple conversations with other states, and the states we've selected to start our conversations with as an agency include Colorado, Oregon, and California, just because they presented kind of three different models of, one, with Colorado sort of established a new agency within their Department of Revenue. Oregon used an existing agency, their Oregon Liquor Control Board, and added cannabis to it. And then California has a sort of split model where the Department of Food and Agriculture is involved with the licensing and regulation of the growers, but then they've got this separate Bureau of Cannabis Control for things beyond that. And one thing that was clear in all the conversations was that the states thus far have put a lot of attention and resources on kind of the licensing and the auditing or investigation component of things. Primarily because they've been concerned with product tracking, regulating inversion and diversion, and then also making sure they've got a good grasp of kind of the tax revenues and accurate accounting of, moving things from black market into legal market. But some of the things that I think we have seen in possible, maybe have been overlooked in other states, or other states are just getting around to putting attention to these, are other aspects of the system, such as, from our perspective, pesticide use and misuse in products, and who kind of handles that. Food safety concerns, and this is aside from maybe the dosing conversation we had earlier. Issues of weights and measures, and who's regulating, scales and weighing and measuring devices that may be used in the industry. Plant pests, and there was invasive species mentioned in the call earlier, and then general kind of administrative support and oversight for the other agencies that may not be the primary regulatory agency, but have programs that touch on the cannabis industry and have to provide valuable services to the industry.
Brad, I guess these are some things that we can start with in terms of some of the points of discussion that we've made, and I'm sure there are others on the call who have some considerations that we would want to include as part of this discussion in terms of questions that we would have to address down the road.
One quick thing before we move on any further, I'd like to recognize that we have David Barron from the Department of Forensic Science, and I think David now I see you on the list now. If you want to introduce yourself.
Hi, I'm David Barron. I'm the Deputy Director for the Virginia Department of Forensic Science. Thanks.
Thank you. So to me, Jewel, something that's really interesting is thinking about really how the other states that have implemented these programs have kind of structured themselves in terms of, they've put it in a single state agency like Massachusetts has done, and like Secretary Moran was telling us in the last meeting, or they have divided it up based on kind of area of responsibility to a number of different agencies, with making sure also that those agencies are communicating. When I think about we always kind of draw the parallel between marijuana and alcohol when we're talking about policy questions, and sometimes that makes sense, and sometimes it really doesn't. But when I think about the work that we do here in our secretariat with the wine industry, where it's really it's a very cross-secretarial area and a cross-agency industry, but it's a controlled product. And so that would be a model that I feel like we already have in Virginia that we could kind of look at and maybe build from. But then again, like others have said, there are some states where they have put everything cannabis related, whether that's adult use or medical use or whatever in the entire process, all under one umbrella. So I know we have some folks on this group who have experience working with these other states in the same way that we talked about legal and regulatory issues, but how have other states structured this, and what have been some of the pros and cons of each as we understand them?
Well, Nigist here, once again. I would just put forward, I think one of the things we've seen coming through COVID especially is that the states that have had some type of centralized or designated cannabis regulator have more ability to focus on cannabis related topics when you have a crisis like a global pandemic hit. And so in the places where we have multiple regulators or we're in different places, we find that we have seen through COVID as government employees get tapped for other emergent initiatives, aspects of the cannabis program have become incredibly slow and even and hard to navigate without kind of a designated cannabis regulator. We've also used in DC, I think they're about to shift the regulation from the Department of Health to another district agency, which has been something that's been in the works for a while, but has become especially important now that the DC Department of Health has to focus on COVID in Illinois. They have kind of a hybrid model where they have kind of a central cannabis commissioner, advisor who oversees a lot of it, but some parts of it go through different parts of the state. Regulator like Ag still's regulating cultivation, Health is still regulating the medical program, and I think it's their consumer services. I always get some of those acronyms mixed up, who run like the social equity program and the retail adult use retail side, and that can be so yeah, I'm glad that we're looking at a bunch of different state models, but I would just put forward that, starting these programs up takes a lot of staff and dedicated time and effort, and making sure that the folks who are going to have to do all of this work are appropriately resourced and supported will be important.
Thank you, Nigist. As I mentioned on the previous subgroup, fortunately, this is something that JLARC is exploring, and with the assistance of a consulting firm that specializes in helping states create regulatory agencies specific to cannabis. Currently in Virginia, just so that everyone has a general idea of the landscape, we have Board of Pharmacy regulating medical cannabis, and we have VDACs regulating industrial hemp. Anytime these two communicate, we have to legislate that. So that's not an ideal working situation, nor is it ideal to have products that are consumed in the same way, regulated differently for consumer safety, regardless of the reason. They're all consumed in the same ways. And that need for safety doesn't change based on reason for consumption. My hope is that we're able to provide some uniform guidance and cohesion amongst these, what ultimately will be 3 silos, as we move forward with expanding our cannabis regulation in the state of Virginia.
I appreciate Jen's point in terms of how we can eliminate some of the barriers in terms of communications, because I think that there are a few different agencies in the state of Virginia who have expertise but who is going to be either the lead agency, or is there going to be a new agency formed to provide the oversight? And just for example, in Colorado, they have their marijuana program, adult use marijuana program, under the Oregon Liquor Control Commission. And so they have, under that commission, 59 positions that were assigned for recreational marijuana. I think 23 have been assigned for tracking growers. They have regulatory inspectors who are looking for violations, 13 license investigators, 16 licensing technicians, 7 policy and data analysts, and someone who handles communication. So that's just an example of how they have used their FTEs. I know in terms of departments of agriculture, usually the engagement of the departments of agriculture have been, as Charles brought up, pesticide use, oversight of pesticide use, food safety inspections in terms of edibles and others, the licensing requirements, and weights and measures. So typically you will see the departments of agriculture engaged with some of those functions, and then some of the other functions go to different agencies that have enforcement expertise, or as I said, in Oregon, the Liquor Control Commission is responsible for the oversight of the marijuana licensing and compliance piece. So it varies in every state that you go to.
And to that list, we should also include our analytical laboratories as far as regulatory oversight for those. I believe currently that falls to Board of Pharmacy, but the analytical laboratories are used currently both by our hemp and our medical cannabis licensees, and presumably would be for adult use licensees as well.
That's, I'm sorry, go ahead.
I was just adding in something regarding funding and things that we sort of heard. As far as we've been able to tell, most states, their licensing and auditing investigation programs are being funded through the licensing fees that are charged. But some of the other, I think something that may not have been considered fully in some other states is some of the agencies that have to provide additional services, funding mechanisms really weren't put in place for those, or those states were lucky in that, for example, their weights and measures may be a fee for service in that state. So, hey, if they've got additional devices and they have to certify scales in the dispensary is paying for that, but that's not always the case in Virginia, where some of our programs are not fee for service, or we charge a fee that doesn't cover the cost of that service. And so I think structurally figuring out not only how Virginia would cover the additional FTEs for licensing, auditing, investigation, but then also how we would cover the cost for some of these other services that are going to need to be provided, whether they're food safety services or pesticide investigation or other things.
This is David Brown with the Department of Health Professions. The Board of Pharmacy obviously currently regulates the medical marijuana program in Virginia, but we really do see the need for having an umbrella agency, especially as we try to diversify the players in the game to make this more equitable and provide opportunities at the retail level, at the farmers level. If we move away from the vertically integrated system we have now, it gets outside of the ability of the Board of Pharmacy to have the knowledge to effectively regulate. I mean, we don't do farmers, for example. And it also means in order to capture taxes and other revenue, it again needs to get out of our hands. We see a role for ourselves in overseeing some of the aspects that involve the medical marijuana program. It's not clear to me whether there would be a role in the recreational program for, but we would capture our cost through charging a fee for a permit, say for someone to produce medicinal products would require, we would envision having a fee for the Board of Pharmacy to permit that facility to do their actions. But then we can inspect them, we can deal with complaints, and have an appropriate fee to cover our cost. And that may not be something that other agencies can do, but connected to that is, as I said last time, we think that whatever system is set up should encompass both recreational adult use and medical use, because it would just be very confusing and cumbersome to have two parallel systems.
I agree absolutely with Dr. Brown's sentiment.
So it kind of seems to me like, from what I'm hearing, that there are kind of three different tracks that we could potentially go on, and I think that I'm hearing some support for one over the others. But one could be perhaps just leaving our program siloed in the way that it is, and putting different responsibilities at different state agencies. One could be creating a new cannabis agency that kind of encompasses everything or most everything that we need to consider. And then maybe a third would be kind of something that's a little bit of a hybrid, where state agencies that currently exist would keep a lot of their same responsibilities, but there might be some sort of umbrella board or commission, or I don't know how we would structure that, but I don't know if there are any other places within Virginia government where that type of structure exists, but something to kind of be the overall umbrella, but also allow the expertise within those different agencies to work as well. But that's just how I've started thinking about it in my mind based on this conversation today.
Brad, I think that's a really good consideration, having those options to take a look at. And again, I don't know if we had that hybrid option, what would be the appropriate oversight. But I think this starts us off with these models that we could consider the pluses and minuses to before we make some final recommendation.
So, Jewel, if I might jump in here and see if we can, now that we've had some of this conversation and Charles's comments about FTEs and resources really made me think about this. But, I think a big part of what this group is asked to do, right there in the description in the legislation, is the fiscal implications for the Commonwealth. And so I think if we could spend some time today talking about how we'd like to go about, what methodology we'd like to use to come up with what the fiscal implications could potentially be. I think it's going to involve some calculation and estimation on our part, but we have some great partners through VCU and the Wilder School. We have partners with us today from the Department of Taxation. We also have team members from our Secretary of Finance who aren't here with us today, but are serving on this work group. So again, just back out to the group to talk about how we'd like to go about digging into the numbers.
And just to follow up with what Brad said, as you look at the various states, they utilize different funding structures. I think more often than not, they're attempting to set up some sort of fee structure as opposed to relying on general funds from the General Assembly. However, some states have obtained funding from their General Assemblies to get the program started, and then transition to a fee structure to cover the cost of the program. So those are some things that we might want to consider in terms of how do we establish a fee structure and what may be potentially needed as we guess what are going to be kind of the upstart costs for the oversight of this program. This is Julie. I just wanted, we had a very good conversation about social equity. And as I stated on the last call, in terms of fees, we wanted to make sure that we had opportunities for everyone to be able to enter into the business opportunity. And so I didn't know if anyone had any comments or things that we needed to consider in terms of fees from a social equity lens.
Jewel, I mentioned this on our previous discussion, but I think that it's advantageous for the Commonwealth to explore how we might use early licensing fees from existing regulators to help provide capital to social equity applicants who may otherwise historically have not had access to such capital.
Yeah, I just want to add, not to keep bringing up the Illinois model, but I think they had done an excellent setup there with the fees from the, sorry, I had to step away and ran back to get back here. Let me catch my breath. But Illinois set up an interesting model where they used the fees that were levied from the existing medical operators to help reduce the fees for social equity applicants. They also had a process for social equity applicants to waive the fee, I believe, if necessary, in addition to creating some state-operated funding mechanisms. However, having said that, I think those were excellent steps in the right direction. But the state-specific loan and funding options for social equity applicants would be very limited in terms of the actual capital needed to start a retail dispensary in Illinois and anywhere. So I think it's a step in the right direction, but it can't solve everything. I think, Julie, you had also brought up technical assistance, and I think that's something that's also really important, and that Virginia has a lot of existing programs that provide technical assistance through our SWAM and DBE programs, and Richmond, for example, has the Office of Community Wealth Building, and I think there's some ways to kind of levy the existing small business programs to create that opportunity. And then I think there's the other piece of social equity when we talk about the fiscal and structural design, where equity isn't just about being able to own a cannabis business. Like when folks were being arrested and convicted, we weren't just arresting aspiring cannabis owners, we were arresting graphic designers and restaurant owners and, tech innovators and folks like that. And so providing, if we're going to take social equity seriously, making sure that we are thinking more broadly about how we can help folks who have been systematically disenfranchised due to a cannabis conviction get back on their feet and have opportunities, as well as I think one key part in the Illinois model was they did a geographic analysis. So it's not just if you've been convicted, but we all know that there were community level effects from the way we operated under the war on drugs and cannabis prohibition. And so even folks who had no potentially direct interaction with the justice system because of cannabis prohibition still suffered as a result of the different unintended consequences from that policy choice. And so thinking about models like Illinois' R3 reinvestment fund that is creating a grant-based model based off of cannabis tax revenue that will be returned to communities to deal with, again, all of those myriad equity-related issues. And I think that piece of being both aware of it within the cannabis industry, but just more broadly, not everybody who was impacted by cannabis prohibition wants to own a cannabis dispensary.
I think the question about the dispensaries, one of the assumptions I think we need to take a look at is because of Virginia's fairly unique liquor kind of distribution system and retail system, compared to many of the states that have legal cannabis, is whether the assumption is that the adult use cannabis retail system would look like our retail system for liquor, or would it look completely differently? Other states have got, some states have got 100% privatized, retail sales in those states. There are other states like Oregon that have, their own state liquor stores and private liquor stores. And my understanding is they do the same for cannabis, where they've got some state-run entities and some private entities, and what the assumption is for Virginia in terms of retail distribution.
And I can certainly say that there's been extraordinary interest in the economic opportunity that a regulated adult use market would provide specifically to Virginians.
Yeah, I think if we do state run, one, I know other states have looked at this and chosen not to as well, because there are also federal implications while we still operate under federal prohibition, in addition to the fact that it significantly reduces the opportunities for social equity participants to be able to participate in the process.
Brought this up on the last call, but in terms of structure, some states consider the localities, and there's an opt-in or opt-out for localities in terms of whether or not they want to have those businesses within the localities. And if they decide not to, they forego the sales revenue, but they do have a say in what's going to be established within the locality, which will directly impact state licensing.
That makes me remember another point that in our first meeting, Dave Cotter brought up was in some of the past legislation that Virginia has considered. There have been various taxation rates on retail sales, and Jules' comment about localities reminded me of this, but in one of those, so that various rates of 9.7% in one, 10% in another for the bills from this last year. But one of the provisions of that was that localities get a portion of the receipts of that tax. But I think taxation on the retail sales is something else that would be good for us to consider. And I'm curious if, sorry to put you on the spot, Kristen from Department of Taxation, but curious if you all have had any conversations related to that, maybe I'm sure you did during this past session when these bills came up, but just how you're thinking about what a retail sales tax on marijuana would look like.
Hey, sure. So yeah, during the session, when we submitted our impact analysis to DPB, we said unknown. Part of our, that the impact would be unknown of the proposed taxes. Part of our struggle has been figuring out, exactly what Virginia's, I guess, tax base would look like as compared to other states, and we just really haven't, yet had a lot of time to put into it. But we have talked a little bit. JLARC has been doing their study, so we've had some preliminary discussions with them and done a little bit of background research, not a whole lot yet. I'm just kind of talking about what would be a consideration and trying to figure out what the revenue impact is. I know one thing obviously is the higher the tax rate, the larger the amount of stuff that stays in the black market versus coming into the legal market. So that's a consideration when thinking about the tax rate. There are also considerations like who would be the one responsible for remitting the tax? Would it be at the wholesaler level or would it be at the retail level like you mentioned? I think the bills so far have done it at the retail level, which seems, from what I've seen in other states, to probably be maybe a little more straightforward way of computing the tax. Some states, I think, do it based on price, which I think is what the proposals in Virginia have been. Some states, I think, maybe look at THC content or weight or something a little bit different. So those are, I guess, things to also think about. And maybe also, again, looking at price sensitivity and elasticity of demand as you increase the rate or as the prices change, that will obviously influence who's buying these products legally versus not. I think the biggest thing, if you're trying to look at what the revenue estimate would be or what the impact would be to Virginia from a fiscal standpoint, is trying to determine what the potential demand would be in the state of Virginia. I know there's some national surveys that are pretty detailed looking at monthly usage. So I think that's one thing that could be taken into account, and also making some assumptions, which we don't have a lot of expertise with, but I know, other estimates that have been out there have looked at things like what would be the assumptions about the black market, what would be the age restrictions. I think in Virginia, the assumption was 21 would be the legal age where it could be purchased. And then also looking at things like the states around us, would people come into the state to purchase in Virginia? And also what products would be subject to the tax? Would you include edibles, just products that could be smoked? Would it be everything, that sort of thing? Those are kind of the things we've looked at in the past, if that's helpful at all.
Could a portion of the tax be used for, I guess, social equity programs and either rehabilitation or those technical programs you mentioned for those communities that were more highly impacted by the prohibition of marijuana? And I'm seeing a lot of opportunity, but I'm also seeing a lot of interest from the farm side in terms of probably a lot more agritourism based entities. And then how would you tax those? And then can you double tax wholesale and retail to ensure that certain things are funded in those communities? As much as I hear Mrs. Collins and the black market tax and the demand, I see, because it is illegal, that sometimes the risk of going to jail versus paying a small fee to do it legally usually can really, I guess, hamper down the black market, and especially if it's a quality product.
Yeah, I can try to answer some. Oh, go ahead.
No, go ahead.
Okay. I can kind of try to answer some of that. I mean, I think in terms of if you want to use some of the revenues to a dedicated source, I think absolutely there are lots of taxes in Virginia right now that, where a portion of the revenues are dedicated to a particular cause. So you could put it in a fund and require that it be used for that purpose. I don't see that being an issue at all. In terms of applying a tax both at the wholesaler and the retailer level, I think that could be very complicated. I think you would probably want to pick one or the other, but either way you could, dedicate, usually it's a percentage of the revenues go to a specific fund, or the first X number of dollars, goes to a particular fund is usually how it's structured. But I think absolutely that might be a good way, instead of charging a higher fee, that might be a good way to go about it.
The one thing I just wanted to add on taxes is if we continue down the route that other states have, where medical locations are allowed to participate and with a fee and then co-locate medical and adult use. One of the things that's important, two things on that front. One, making sure that there's a priority on stocking the medical cannabis side is really important. Patients need this to treat medical illnesses, and other states have created effective programs to ensure that both the supply for the medical side remains robust and diverse, while also allowing for specific changes. Typically, the medical side has been allowed to increase the dose maximum to give patients more flexibility and more cost-effective options for their treatment. And then, you can see this easily if you go look at Illinois dispensaries. There's a medical menu and then adult use menu, and the medical menu is much more robust. It includes things like nasal sprays for epileptic seizure emergency relief, and suppository, like vaginal suppositories for endometriosis pain, and very specialized products. And then, but then there are also some products that, similar to how you can buy ibuprofen over the counter for 200 milligrams, or you can get a prescription for 800 milligram ibuprofen. There are some products that at a lower dose are more, can be used on both adult use or medical side, and creating a tax structure that allows us to both prioritize the medical side and make sure that patients have all the options they need to manage their illnesses, but also prevents medical operators and suppliers. The 347 HB 347 work group is also talking about the expansion of the medical program and other items there. Thinking about where that tax happens in order to avoid having to, in order to do that at the latest possible moment in the production process, so that we can, allocate our plants. Like if we have a surge in patient signups, then we need to be able to put more plants towards medical product and be able to manage our supply chains in ways that keep us responsive to the market, and prevent us from having to, like, even at the plant stage, decide which plant is going to be for an adult use product and which plant is for a medical product. Like, that system does not work. It's not really sustainable for medical operators and folks who have to grow for both sides. And just thinking about keeping the tax as late as possible in the process in order to facilitate, options for the medical and adult use markets.
Hey, this is Kristen again. I have one comment too on the specifically to the medical marijuana. If under the retail sales and use tax law currently, if medical marijuana is legalized, it wouldn't be subject to the current retail sales and use tax. So I think any excise tax would probably treat it similarly. So I'll just throw that out there as well. To if we were to apply the existing policy, medical would be treated differently than recreational.
Is all very that.
Yeah, currently Virginia's medical cannabis program is both legal and not taxed.
I think that this is David Brown. I think that most states that regulate medical cannabis do charge a sales tax or some other type of tax on it. Virginia does not, in part because it's regulated by the Board of Pharmacy, who does not have any authority to levy a tax.
I believe the vast majority of medical states do not impose a tax on medical cannabis. There are definitely a few exceptions, but most of the medical markets do not have a tax on patient transactions.
Maybe that's something we should research, because I read through a document that summarized the medical programs, and it appeared that more than not did charge a sales tax, but I'm sure that's something we can figure out as we go along.
Kristen, you were talking about how you all have not had the chance to really dig into this in terms of what the actual impact could be. And I think this is something that the JLARC report is going to be working on, and I think this is also something that with this group would have a good opportunity to work on, especially with what the General Assembly's kind of asked us to do. A good place to start might be, I'm wondering if Mike McKenzie could talk a little bit about some of the research that you all have done at the Wilder School around this, because I think I remember Fabrizio mentioning that you all had done some work about this, about kind of like what the market size might be and what the potential revenue could be. But I could be wrong, but if you could just talk some about what research you guys have done, that'd be great.
Sure, I can tell you at this point that that Fabrizio was undertaking that himself. So I have not been privy to that information just yet, but I'm going to talk to him to try to get a lot of that information. I think with any tax impact, what we would be looking at specifically would be a combination of, obviously sales, demand, but also we could be looking at the reduced costs of incarceration, reduced costs of enforcement, as well as the additional costs of new enforcement in different ways. So there would be a few things going into that. But however, I think Fabrizio, I still need to identify the work that he's done on that.
Great, thanks.
We'll also be able to look to JLARC for input on this, as that was a parameter outlined in their study as well.
Yes.
And it's certainly been said before, and it bears repeating, that it's so important that tax rates hit that sweet spot so that it does not incentivize illicit market participation. And if we price consumers out of the market, they won't use it. It's something we deal with in the medical cannabis program, and becomes even more of an issue in an adult use market. It has to be accessible to consumers.
Yeah, and I will echo that. I'll point out that JLARC hired a consultant who has experience doing these revenue estimates in other states. I believe they already have some modeling in place that they're using to, make some assumptions about things like changes in price and whatnot that obviously we wouldn't be able to develop in the next couple of months. So yeah, I think to the extent we're able to have conversations with them and, learn from them, I think that would be very useful.
Great, yeah, we can definitely do that.
I had some thoughts around a comment that David Brown made on the previous call about duplication of efforts across subgroups, and I wanted to maybe hear from you all, especially those who are on the call, if there may be some points of engagement that we might need to discuss with the subgroup that met earlier this morning, so that we're not duplicating efforts. We can have maybe the chairs can have a conversation, to have some agreement on who may take the lead on some of the discussions that are going across both committees, so that we're working effectively, because I thought that was very good. We also need to come together and have some discussion about some of it. So I just was interested in getting some feedback on some of the themes that you're hearing that are going across both committees.
Jewel, this is David Brown again on that. A number of the things we talked about in the last group really fall under the category of the regulatory structure, and I think are more properly addressed in this one. Although I think since there's a lot of overlap in membership, I think we've all heard the same thing both places. It seems to me that to some degree, that what comes out of the recommendations of this group, and I think to a lesser degree perhaps the health group, will then dictate what areas of the code and what areas of our regulations need to be addressed. So it may be that the work of this group will influence the work of the sort of regulatory part.
Yeah, thanks for that. Thanks, David.
Is there anyone on this group that hasn't had a chance to speak yet? Have we heard from Colby at DMV? Anything related here? I think Colby, you had a lot to tell us in the last group meeting, and maybe not as much for this subject matter. But if you have anything to add, love to hear it.
Yeah, I will just note, I wasn't going to bring it up, but since you called me, I will bring it up. So as we know, marijuana is illegal on the federal level, and so the Federal Motor Carrier Safety Administration regulates its use by commercial motor vehicle operators. They attach substantial funding to state compliance to those regulations. So one of the things that we did want to note is that we should think about that if, as a matter of policy, we decide that we do not want to comply with those regulations, that there is a substantial fiscal impact to the Commonwealth for that. And maybe we would want to think about determining whether we need to compensate for that loss. And if we do need to compensate for that loss in federal funding, how we might be able to do so.
That's a great point, Colby. Thank you for bringing that up. That's definitely something that this group needs to keep in mind, and that the General Assembly will need to keep in mind. What about Nate? Nate Green, do you have anything to add on this discussion, Nate?
Not at this time. Right now, I'm just kind of absorbing everything that's being said.
I think we have a great starting point here, and some really great ways to start thinking about these problems. And it sounds like VDAX at least has already done some of the legwork in reaching out to some of the other states, and I know other folks on this work group have really great knowledge about what other states are doing. So I don't want to wrap us up until we're, move us on to the next agenda item until we're really ready. But so I maybe see if Dr. Bernal has gotten her audio worked out, and open it up to any other discussion. See, I think you're on. I just unmuted you, Jewel. Is it working now?
Code. I was trying to dial in by phone, but I couldn't get it to accept my access code. I apologize for my audio.
No, it's all right. It's actually working great now. I think it might just be something related to your internet connection at times.
Okay, I apologize. Thank you.
We hear you loud and clear. Anything else before we move on to the next part of our agenda? I think we're giving ourselves a lot of work to do here. So I guess moving on then to our next agenda item is our group discussion with stakeholders and subject matter experts and how to engage and try to get some external input to these questions. I think one place that I'm hearing that we need to make sure that we're having constant communication is with JLARC and their team who's working on this. So I've talked to them before and need to follow up with them to let them know how things are going on our end, and then let them know what we're talking about. And from the beginning, they were very willing to share information as they could, as is legally allowed by them. There are certain things as they're working on this that they're not going to be allowed to share with us until it becomes public in the report. But I will continue to reach out and make that connection with JLARC. And then as we have other ideas, Secretary Moran had a great thought to invite the person from Massachusetts, Stephen Hoffman, who is overseeing their cannabis program, and they're a state who has kind of put it all under one umbrella. I think it would be really helpful for us to hear from maybe even a couple more states who do things even a little bit differently, to hear kind of the challenges that they've gone through and how they've overcome those. So that's something, if anyone else has any other contacts in those other states at a high level from their cannabis programs, let us know and we can try to get them on the agenda at one of our upcoming meetings.
Brad, and Gis brought up the Illinois, I know she brought up the state of Illinois. I'm not sure what the agency is for that state for us to talk to. She suggested that more than one time.
Yeah, that's a great point. I guess has really pointed to Illinois.
Yeah, Toy Hutchison is the senior advisor on the cannabis programs, and I'm happy to help facilitate that.
Great, thank you. I'll shoot you an email sometime after we wrap up.
Charles here. What may be helpful also is as people are sending you information, if they've got, certainly it's not feasible for all of us to communicate with every state that has a cannabis program, but if people have got really specific, like the Illinois example of, there's a component of a state program that seems to really work well that they want this group to look into further, or there's a component of another state program that really looks awful and we would want to stay away from, that maybe they just send you those very specific points of, hey, this state has a really great aspect of their program, whether it's overarching cannabis czar or committee, or whether it's the social equity, or whether it's something else, but we can hone in on those areas to focus in on or stay away from as the group makes a recommendation.
I'm not sure, and I'll ask Charles to weigh in on this. I know I brought up the seed to sale tracking a couple of times, and we spoke with a company called Metric that was very helpful in explaining how that process works and what services that system can provide. So I don't know if we want to have any engagement with them. We have already spoken with them, but if anyone has questions about how that system works, perhaps you can either just share the questions with us and we can provide the answers, or if the subgroup so desires, we may have them do a small presentation at some point.
Any other ideas or comments from anyone? And I know some of us have been on this call for over 3 hours now, so appreciate everyone sticking with us. As we've gone through this, and I think this is going to be more true in the work of this subgroup than maybe of the others. But I want all of us to be thinking about what the final report is going to look like in terms of, are we making specific recommendations to the General Assembly? You know, we've looked at everything out there, and this is how we recommend Virginia move forward. Or is it going to be a case where we say we've looked at everything out there, and here's kind of a menu of options with pros and cons of each for the General Assembly to then choose from. So I just say that to kind of put it in everyone's mind that as we're having these conversations, I think there are a couple different routes that we could go, and maybe one will become self-evident, more clear as we go through this process, but just putting that on your radar. All right. Well, I will take us into the next agenda item, which is finalizing our work plan and setting the next meeting date. And this, you know, in terms of finalizing work plan, I think just making sure that we're all have all been comfortable with the questions that have been posed, and then, you know, Heidi and I will kind of take these notes after this meeting, make sure that we compile everything in the right way, and then send it out to the whole group after every subgroup has had a chance to meet. And so the work plan is just kind of using that to continue to do additional research, and then we'll figure out a mechanism to send any information, thoughts that you have, probably to a centralized place, like directly to me, and then we'll figure out a way to share it to all the members of the group, just to make sure that we stay in compliance with our open meeting laws and that the public has a chance to see that as well. And then setting our next meeting date, and keeping in mind that we have the special session that's starting tomorrow. The previous work group was looking at trying to do another meeting the week before our next full work group meeting, which is on September the 16th. But the week before is Labor Day week, but it sounded like most folks were available. One date that we want to avoid is September the 10th, because that's the big national cannabis policy discussion that happens every year that a lot of us probably want to listen in on. So looking at maybe the 8th, the 9th, or the 11th of that week. But I can send out another doodle poll that seemed to work well for this, setting up this meeting. But if anyone has any thoughts on when we should do another meeting, be happy to hear those. And then something else that I brought up in the last meeting is, in talking with colleagues here in the Patrick Henry building, we've gotten some good ideas about how to do something that's a little more public facing. Of course, all these meetings are open public meetings, but doing something to build relationships with members of the public, where we could promote it more heavily from the governor's office to get some additional participation. So something like a series of listening sessions with panels on the various topics that we're talking about, I think would be good as well. And looking at something like doing something like that, we'd probably do, rather than doing it during the workday, doing it during the evening for a couple hours, or usually an hour and a half before dinner, so that folks who are working during the day can have a chance to participate. But that's something that we'll continue to have conversations with our colleagues here about. So before we move on to public comment, I just want to open the floor up one more time to see if anyone else has any final comments before we close out this meeting. I see that Secretary Moran is still with us, so would ask if Brian, if you're there, and if you have any other additional comments to share with us, we'd love to hear those, and also Katie Finley as well from Secretary Kerry's office.
No, I'm here, Brad. Thank you. No, I don't really have any additional comments. I think this is proceeding well, and I like the idea that you've just mentioned with respect to the listening sessions. I do think we need, since other states have, now that you asked, I will say, since other states have you know, kind of, you know, created the path for us. We probably should try to learn from them. Both mistakes. I mean, I know Colorado's still trying to get it right after years. And many states went the direction based on voter referendum. So they really didn't have this opportunity to deliberate and analyze the best procedure. They just had it by voter referendum, and they had to respond. And we actually have the luxury of spending some time to get this right. And we should learn from others in what they tried. Recognizing Virginia is unique, but particularly the equity issue is one we really need to emphasize, as well as the end product needs to recognize that. Since you asked, I just offered that, and hopefully the next meeting, maybe we'll have some of those other states be able to inform our thought process.
All right, thank you, Secretary. Anything from you, Katie?
I'll just agree with Secretary Moran and say I think we're on a really good path here, and really appreciate Nega's comments on the impact on the medical cannabis program. In that other work group, we're definitely focusing on, you know, both equity issues as it pertains to medical cannabis program, also thinking about how legalization would impact the cannabis program, and then really keeping patients in mind. So really just appreciate those comments, and in addition to listening in and participating in all of this, we'll be especially focused on the health impacts and then kind of that intersection with the medical cannabis program. So thank you so much. That's really it from me.
Great, thanks, Katie. So if there's nothing else from anyone on the subgroup, we'll go into our public comment period. I think the only, let me put this list. Let's see. I think the only person that I had for public comment for this subgroup was Jasmine, and Jasmine Washington. I think Jasmine indicated in the last meeting that was a misclick on her part. So I'll just open it up now to other members of the public who are following along. If you want to speak, please raise your hand. Use the raise hand function down at the bottom of your chat screen. And then if you're on the phone, calling in on the phone, it's *3, and we'll see your raised hand. So I see Ann Lee. Oh, I need to unmute you. I'm sorry.
That's okay. This technology is a little beyond me as well. Most folks heard me on the last call that I represent Scott's Miracle Grow with the subsidiary of Hawthorne Gardening. And I would just say again, when you figure out which group is going to tackle which topic, to what the commissioner was talking about, and also what Mr. Green was talking about with pesticide use, misuse, invasive species, and that sort of thing. We have Hawthorne and Scott's Miracle Grow have a lot of history in working with this in the other states. And to what Secretary Moran said about what has worked and what has not worked, we are happy to provide any information, whether it's a presentation or whether it's sort of one-on-one background. Just know you can reach out to us and maybe save some work, because this is a tight time frame for y'all to get a lot of information, and we have a lot of information. So just reach out to me and we'll be happy to provide that.
Thank you. And Ann Lee was the only person that raised her hand this last time, but I still have hands raised from the last meeting from Michael Crowitz and Chris Layan. Do either one of you want to say anything?
It was because your two commitments are running right into each other.
Yeah, well, they'll be concerned too.
All right, I think that is all we have at this time. So thanks again, everyone. I think we determined on the last meeting, and we don't need a motion or anything to vote to adjourn, but we'll just say thanks again to everyone for participating, especially to everyone who's been on since 9 o'clock, and some of us since 8:30 this morning. I know it's been a long morning, but I think we had productive conversations and are moving in the right direction. So thanks again, and good luck to everyone who's going to be working with the General Assembly in the special session, and I will be in touch. Thanks.
Brad.